Hello, my name is Paulette Peláez and I will talk about the vitamin D binding protein defensive of the homozygous deletion of the GC gene. Definition: vitamin D is produced by photochemical conversion of the 7-dehydrocholesterol to the vitamin D3 in the skin, or is occurred through the diet as iodide, cholecalciferol, or vitamin D2. Epidemiologic studies have proposed that vitamin D deficiency is associated with common health problems such as cancer, cardiovascular disease, diabetes, and various autoimmune conditions.
We have two types of vitamin D have been found in the nature. Ergosterol, which is produced from the plants, which is a provitamin called as D2, and 7-dehydrocholesterol, which is a provitamin called as D3 found in the skin. And what are the sources? And the sources where it is formed in sun exposed skin, and richest source is liver oil. And what about daily requirement? Adults require approximately 100 international units or 2.5 micrograms, whereas the pregnant as well as lactating mother needs 400 international units, and infants and children require 200 international units. Here you can see the metabolic pathway of the vitamin D synthesis. So here the vitamin D is synthesized in the skin from provitamin D3, that is 7-dehydrocholesterol, in the presence of ultraviolet light, and it is then hydroxylated to 25-hydroxycholecalciferol, which is also called as calcidiol, in the liver by 25-alpha hydroxylase enzyme, and it is finally gets converted into biologically active form of vitamin D in the kidney by means of an enzyme called as 1-alpha hydroxylase to form 1,25-dihydroxycholecalciferol, and finally the 1,25-dihydroxycholecalciferol, which is a calcitriol, is called as active form of vitamin D. So what about the functions of vitamin D? It increases intestinal absorption of calcium as well as phosphate by synthesizing calcium binding proteins in the intestine, and it is also responsible for mineralization of bones mediated through osteoblasts. And what about the deficiency manifestations? Rickets seen in children and osteomalacia in adults. So in rickets there is inadequate mineralization of bone, and it occurs before the closure of epiphyseal plate, typically in the children. And osteomalacia, where there is inadequate mineralization of the bone and occurs after the closure of epiphyseal plate, and renal osteodystrophy in adults. So this is the difference between the rickets as well as osteomalacia. And what about vitamin D excess? If vitamin D taken in larger doses, like approximately 500 to 1000 times of normal requirement for prolonged periods, so there are like immediate effects as well as delayed effects. So immediate effects are like thirst, anorexia, constipation, and polyuria, followed by nausea, vomiting, and diarrhea. And delayed effects, if you see, there will be hypercalcemia, urolithiasis, metastatic calcification, and sarcoidosis. And this is about vitamin D.
Application in medicine. Vitamin D binding protein is inculcated by a specific component to the GC group and gene of the chromosome 4q13 along with albumin, alpha-fetoprotein, and alpha-amine that give rise to the three common haplotypes which appear to correlate with pigmentation of the skin. Some exposure are possibly binding to the vitamin D metabolic affinity.
Supplements are very controversial these days. For some years now, there's been a large promotion of vitamin D supplements, often by the nutrition industry and by non-medical personnel. There's been some recent studies that suggest that vitamin D might lower blood pressure, but these studies are not of the highest quality. There's also controversy because national authorities are not certain what level of vitamin D actually is a normal level and what constitutes a low level. Our advice is not to start vitamin D as a means to lower blood pressure. There's really not enough evidence to suggest that that's a beneficial approach. Again, caution is indicated. Not taking vitamin D unless there's a very clear indication is probably the right policy, with one exception. Calcium and vitamin D in women, particularly women at risk for osteoporosis, does have benefits. For the male gender, there's less evidence of benefit. There's uncertainty about what a normal level is. It's certainly not in prime time approach to lowering blood pressure and shouldn't be relied upon as a means to control blood pressure for those patients that have hypertension.
Pros and cons. Pros. Free vitamin D metabolites, which are in equilibrium with both vitamin D. Metabolites are available for the cellular functions. Cons. Severe vitamin D deficiency leads to the rickets in children and the osteomalacia in adults. Congenital absence of the vitamin D binding protein resulted in the normocalcemia and the relative mild disruption of the bone metabolism.
D is responsible for the absorption of calcium and phosphate in the body. It's produced by the body in response to sunlight and occurs naturally in a few foods such as fish, egg yolks, dairy and grains. It's essential for the bones as it helps the body absorb calcium, and a lack of this vitamin can lead to rickets, a disease where the bones soften and become deformed. Vitamin D deficiencies usually occur if you do not get enough sun, are suffering from milk allergies, or following a strict vegetarian diet. Not everyone lacking in vitamin D will experience symptoms, but some people may have bone pain and muscle weakness. People who lack in vitamin D are also at increased risk of cardiovascular disease, cancer, cognitive impairment, and asthma. Vitamin D is also thought to play a role in the prevention of diabetes. Vitamin D deficiencies are common in the UK and can occur for a number of reasons. People who follow strict vegetarian or vegan diets are at increased risk, as most natural sources of vitamin come from animal-based products such as fish, fish oils, egg yolks, cheese, and beef liver. If your exposure to sunlight is limited, you are also at increased risk of vitamin D deficiency. This is because your body converts sunlight into vitamin D. So people who are housebound, who keep covered, whose work conditions keep them from sunlight, or who live in northern latitudes are at greater risk. If you have dark skin, you may also experience a deficiency. This is because the pigment melanin reduces the skin's ability to make vitamin D in response to sun exposure. Studies show the older adults with dark skin are at increased risk of a vitamin D deficiency. As people age, their kidneys are less able to convert vitamin D into its active form, known as calcitrol. They are then at increased risk of deficiency. Health conditions such as Crohn's disease, cystic fibrosis, and celiac disease can affect the intestine's ability to absorb vitamin D from food. You are at increased risk of a vitamin D deficiency if you are obese. Vitamin D is extracted from the blood by fat cells, altering its release into the circulation. People with a BMI index of 30 or greater often have low levels of vitamin D, putting them at a greater risk of heart conditions and diabetes.
Insuoplatin in Ecuador. In Ecuador, there are cases of the insufficient level of vitamin D, but there is another study that shows that it is to do the lack of the proteins in the union with the vitamin D.
This morning about vitamin D. The CDC says some of us are not getting enough of it, and a new study finds that can have long-term consequences for your health. Dr. Holly Phillips is with us to explain. Good morning.
Good morning.
Okay, so what does this study show?
Well, this study looked at older people between the ages of 65 and 88. And they found out that people who were deficient in vitamin D were more likely to have trouble doing daily basic tasks, like walking up the stairs, getting dressed, or even sitting down and standing up from a chair.
So how do we get more vitamin D?
Well, you know what? One of the reasons I have to say that we're finding so many people who are vitamin D deficient is because we're looking for them now. Really, vitamin D testing has become in fashion. I know it's hard to think of a blood test as fashionable, but that's really what's happened as we've started to understand the risks of deficiency. But one of the reasons we're so vitamin D deficient is that many of us are avoiding the sun and we're wearing sunscreen. That's great news for skin cancer prevention, not such good news for our vitamin D levels.
So one of the questions is how is this related to other health issues?
Well, in addition to cognitive impairment in older people, we've long known that vitamin D, if you're deficient, can cause weak bones. Vitamin D helps our bones to utilize and absorb calcium. Without it, they become weak. But the vitamin's also linked with many other issues. If you're deficient, you're more likely to die from heart disease. You may be more likely to have multiple sclerosis, and even things like difficulty sleeping. Severe vitamin D deficiency can cause that.
Okay, I know my vitamin D levels in my last blood test were borderline, they said, but I'm fair-skinned, so I wear sunscreen all the time. How much time do you have to spend in the sun to get vitamin D up?
Right, well, 90% of the vitamin D we need, we can get from the sun just 10 minutes a day. You don't have to lay out and tan. It can just be indirect sun exposure, walking to your car safe from work.
Conclusion: the absence of the vitamin D binding proteins produce an apparent severe deficiency of the vitamin D, but it's not that difficult for the person to present serious consequences, since with a sufficient diet, exposure to the sun, and with the help of the supplement will not have serious consequences.
Vitamin D, this may be the image that comes to mind. But doctors say vitamin D deficiency can be caused by other factors.
Really, vitamin D deficiency comes in two ways in America, and mostly one is if you have some sort of malabsorption disease, such as celiac disease or Crohn's disease, or some sort of other disease where you're not able to absorb nutrients from your food. The other way is certainly sunlight exposure or lack of.
Using a blood test, doctors can determine if a patient has a deficiency. Anything under 30 is considered vitamin D deficient.
We